Good morning. I'm Li Ming, a practicing pediatrician in KK with an interest in child advocacy work. Today, I'm very excited to be sharing with you the topic of child neglect, the invisible abuse. Child neglect is not easily seen, but it is a very important aspect of child abuse. In our short time together, I hope to be able to introduce to you what child neglect is, how to identify it, as well as share 2 real-life cases of neglect. So what is child neglect? Based on the WHO definition, child neglect is when a parent fails to provide for the development of the child and he or she has the ability to do so. While the areas affected are health, education, emotional development, nutrition, shelter, and safe living conditions. So it must be distinguished from the circumstances of poverty. Cases with complex social background can make neglect difficult to pick up. So some of the questions that child advocates like myself will ask will be, what are the minimum requirements associated with caring for a child? Well, is it enough to clothe or feed a child? And what are the actions or inactions of a parent or other caregivers that will constitute neglectful behavior? Is the action or inaction a result of poverty rather than neglect? So what then can constitute neglect? A child that does not go to school regularly, a child who is given less nutritious food, a child who has special education needs, but the parents are not bringing the child for the recommended therapy sessions. Are these neglects? Well, these 3 examples can be neglect cases, but more information must be obtained in order to understand the circumstances behind them. So now let's try to define the 5 main types of neglect. Well, they are namely physical neglect, medical neglect, supervision neglect, emotional neglect, and educational neglect. Let's go into a bit more details for each one of them. Physical neglect is the most common type of neglect. It is also the most easily visible type of neglect, well, such as a child who is wearing dirty clothes. Physical neglect can also have other components too, such as the abandonment of a child, an expulsion of a child from a home, shuttling of a child between caregivers, and oftentimes these children could be left in the care of others for a long period without prior arrangement. Nutritional neglect, where a child is being left hungry for hours, evidenced by poor growth. Clothing neglect, and others such as inadequate hygiene. Medical neglect is the second type of neglect. As the name suggests, it relates to the medical care of the child. The caregiver either denies the healthcare needs or delay it. For denial, a caregiver does not provide or follow the medical advice, especially when the medical treatment offers significant benefit for the child. Another form of medical neglect is when there is a delay in the healthcare, whereby there is failure to seek timely and appropriate medical care for a serious health problem. This will include even delay in preventive care, such as a child with multiple dental caries and symptoms, but the caregiver does not seek dental care. The third neglect will be supervision neglect. Well, mainly it is a lack of appropriate supervision of the child, and the child is himself or herself being exposed to hazard unnecessarily, or a child that is left to inappropriate caregivers. And by that, we mean adults who are not safe, a young child being left in the care of an older sibling who are children themselves. Emotional neglect is often the hardest to assess as it is not immediately obvious. However, it has more severe and long-lasting consequences than physical neglect. It relates to inadequate nurturing or affection, even spousal abuse, while allowing the child to engage in high-risk behavior, such as drug, alcohol, and also parents permitting delinquency, and also things like assault, like crimes. And lastly, when we isolate a child emotionally with minimal interaction can also definitely constitute emotional neglect. Educational neglect will be an area where some of our community partners can pick up more easily. It can come in the form of a parent permitting the child to be absent from school, whereby there is habitual absenteeism, sometimes averaging as frequent as 5 days a month. A caregiver who fails to enroll a child in school when it's time to do so, and a caregiver who does not bring the child to the special educational sessions, like therapy sessions, when the child obviously needs so. Well, in truth, many parents, they don't set out to neglect their children. But there are some parents who are just not able to adequately meet a child's need. Sometimes neglect can be completely unintentional, such as the case of a young parent who doesn't understand basic child development. They may not recognize how often their infant needs to be fed or changed, right? And at times, the parent's mental illness or substance abuse issues may also prevent them from providing their children with adequate care. A parent who is under the influence of drugs may not be able to adequately prevent their toddler from, for example, wandering outside alone. So let us understand further. What are the risk factors for neglect? They can be divided mainly into 4 areas: environmental, family factors, parent factors, as well as child factors. In terms of environmental factors, the presence of poverty, the lack of social support, a family who's living in a neighborhood filled with stressors and distress, right? And family factors will include certainly single-parent household, family with constant domestic violence, and also family stress. Parent factors including unemployed status, low socioeconomic status, a parent of young age, a young mother, for example, parent with health issues, mental issues, substance abuse issues as well. Child factors will include things like behavioral issues of a child, developmental delays of a child. So the take home is that child neglect isn't always the result of a parent failing to attend to their children's needs. Sometimes the option just unavailable because of a lack of funding, because lack of resources, and there are other many social factors that can affect and impact the presence of child neglect. So often it is a teacher or a concerned neighbor who may recognize the warning signs that a child is neglected. Well, all of us can play a role in identifying neglect. So when should we consider neglect? Consider neglect when the child is frequently absent from school, a child who has to resort to begging, stealing of food or money, a child who appears to be needing medical or dental care but persistently not receiving it, child who has delayed immunization, or even a child who is short-sighted for a long time but has no glasses, child who is consistently dirty and has severe body odor, looking unkempt, a child who does not have sufficient clothing, or even an older child, for example, who abuses alcohol or other drugs, a child who shares with a caregiver or a community social worker that there is no one to take care of him or her at home. So we can get clues about neglect, even from parents or caregivers. Consider the following. If the adult appears to be indifferent to the child's needs, whether it's emotionally or physically, a caregiver who appears to be apathetic or looking depressed, a caregiver who behaves irrationally or in a bizarre manner, perhaps suggesting that they have some mental health issues or even on drugs, who's abusing alcohol or other kinds of drugs. Well, remember that neglect may not always be easily picked up. So what we understand is that when kids are neglected, this maltreatment actually impacts their overall development and health. But in truth, neglect has been linked to physical, intellectual, emotional, psychosocial, as well as behavioral consequences. Well, interestingly, even if a child is removed from a bad situation, the consequences of neglect can last for a long time and can even lead to high-risk behaviors such as substance abuse in future. To sum it all up, it can be a challenge to recognize neglect. There are 5 main types of neglect: physical, medical, supervision, emotional, and educational. There are huge long-standing impact from child neglect. in many areas such as health, psychosocial, emotional, and behavioral problems, which makes it even more important to identify it earlier. And finally, we actually need a multifaceted approach to actually manage these cases of neglect. We have come to an end of my talk on child neglect. Thank you for listening, and I hope you understand more about neglect now. Remember that neglect has no home here, and you can make it stop. Thank you.